Hi everyone, welcome to our presentation. My name is Sean Castillo and I'm an industrial hygienist at the Georgia Tech OSHA Consultation program. As part of this poster, we're going to talk to you about the effects of engineered stone fabrication on employers and the risk of exposure to something called respirable crystalline silica. In our consultation program, we've had the privilege of going out to facilities and doing personal monitoring on employees for crystalline silica when they're doing fabrication tasks such as polishing, grinding, and cutting. In a lot of the literature and in our own methods, we found that adding controls such as wet controls or ventilation can help to reduce employee exposure. But there are also other variables such as what the kind of stone is being used and what controls are being used at the facility. In our program, we have found higher exposures above OSHA applicable exposure limits. At every facility we did a consultation visit to, we found that at least one employee was overexposed above the OSHA action level, which is at 25 micrograms per meter cubed of respirable crystalline silica. Between the fiscal years of 2017 and 2019, we did 12 visits. 8 of those were initial visits and 4 of those were follow-up. In this presentation, we'll highlight the results and some of the strategies used to protect those employees. Going into a little bit about the background of silica in engineered stone. So engineered stone is essentially a stone that's made by quartz aggregate, which is binded by polymer adhesives or resins. And this process is very popular today because it creates a stone that's durable to scratches, chips, and stains, and it's very aesthetically pleasing to look at. There are estimates that the use of engineered stone in America has gone up by 800% from 2010 to 2018, and we've seen this in other countries as well. The issue isn't for consumers who have this in their kitchens, it's for whenever it's fabricated. So whenever you're cutting or polishing or grinding it, employers can be exposed to respirable crystalline silica, which in turn can cause silicosis and other diseases. So silicosis is an incurable lung disease caused by silica exposure. Other illnesses caused by silica can be lung cancer, bronchitis, tuberculosis, and even renal disease. Silicosis also prevents symptoms such as shortness of breath, fever, fatigue, or chest pain, and it can ultimately lead to respiratory failure and death. Per CDC, from 2017 and 2019, there were 18 cases of silica reported in four different states, and this was solely due to engineered stone fabrication. So these employees were doing grinding, cutting, polishing procedures. This included 2 fatalities as well. The important part about here is that these employees were relatively young workers with ages ranging from 35 to below 50. They were also mostly Hispanic workers and non-Hispanic African American workers as well. So curtail silica exposure, OSHA created a new standard that went into effect in June 23, 2018 for general industry and construction. With the general industry standard, a new permissible exposure limit, or a PEL, of 50 micrograms and an action level of 25 micrograms per meter cube were created. And essentially, when employees are exposed to levels above these limits, the employer has to put in practices and methods to be in compliance with the OSHA standards, such as respiratory protection or having written programs that highlight what protections are going in for your employers, or doing things such as medical surveillance for your employees. As of February 5th, 2020, OSHA has revised a national emphasis program which identifies and targets industries that create silica exposure in their facility. And the industry of stone fabrication facilities is included in this emphasis as well. So silica exposure, it can be controlled using engineering controls, such as using water-fed tools which implement a steady stream of water into your cutting or grinding, also using increased ventilation, or work control such as limiting the amount of time that you're working with certain stones. And the important part about this is that different stones have different percentages of silica. So if you look at something like engineered stone, you can have up to 93% or more percent silica in that stone, as opposed to something like granite, which can have 10 to 45%. So that's an important thing to look at as well. So going forth into the methodology of our sampling, first of all, we had to contact the employers to see what kind of processes they were doing. So if they're doing grinding, cutting, polishing, and how many employees are doing those processes, what kind of shifts are being performed, and what kind of materials are they using. Afterwards, we create a sampling plan and we choose our sampling pumps. We used a variety of sampling pumps. The only thing we had to make sure is that they were applicable with our cyclones that we use. So when you sample for silica, you have to use something called a cyclone, which separates the larger dust particles from the crystalline silica, which is captured on our PVC media. We use two different cyclones. One is called a BGI, which you have to use a 4.2 liter per minute sampling rate, and one is called a Dore-Oliver cyclone, which uses a 1.7 sampling rate. After these were selected, we brought all our media, we went out to the facilities, and we conducted employee monitoring. For most cases, we did multiple samples per employee. After sampling was done, we post-calibrated our pumps to make sure that our sampling rates were the same as what they were when we pre-calibrated, and then we sent them to our occupational lab for analysis. After we received our analysis, we compared them to the OSHA applicable exposure limits and determined if any citations would have been cited by OSHA. We collected our report and we sent it to the employees for further verification that they corrected those hazards. In this time, we conducted 12 crystalline silica sampling visits from the fiscal years of 2017 to 2020. 8 of those were initial visits where it was our first time at a facility, and 4 of those were follow-up visits where a facility wanted us to come back to do follow-up sampling to determine if working conditions or new engineering controls would reduce the employee exposure. After we received the results from our contract lab, we were able to analyze them and make interpretations for the employers. The first thing that we noted is that a total of 45 employers had personal monitoring done for exposure to respirable crystalline silica. In the case of our results that we saw, a number of 29, which was the majority of employees sampled for exposures that were over the permissible exposure limit of 50 micrograms per meter cubed. 10 employees were exposed over the action level, but under the permissible exposure limit, and 15 were under the action level, where no other actions had to take place. For the 29 that were overexposed to the PEL, they have to wear respiratory protection. So we saw a maximum personal exposure of one of our employees to over 2,000 micrograms per meter cubed, and this was 40 times the OSHA PEL. And only 2 sampling visits, and these were both follow-ups, resulted in employee exposures that were below the action level entirely, and no other employees had to follow any OSHA applicable standards. So we also conducted 4 follow-up visits. One visit that we went to, one facility, they were able to reduce employee exposures from above the PEL to under the action level by using a strict adherence to water-fed tools and disallowing the use of compressed air. The reason that not allowing compressed air is important because it basically just sweeps up all of the dust back into the air and back into the employee's breathing zone. One facility, which we're going to highlight with the case study, was able to reduce their higher exposure from 40 times the OSHA PEL to about 4.6 times the OSHA PEL. So they're still over the standard and they still need to put in precautions and follow the standard with things such as respiratory protection and medical surveillance. However, by using wet controls, they were able to reduce those exposures. One facility was not successful at all at reducing employee exposures below the PEL from their initial sampling visit, and therefore they still need to follow the full contents of the OSHA standard. And one facility reduced exposures from over the OSHA PEL to above the OSHA action level. However, this one was shaky because working conditions were not identical on the initial and follow-up surveys. On our initial visit, they worked essentially the entire day. On the follow-up visit, they worked about a half a day and they were using a different kind of stone, so those weren't very representative. One of the facilities we went out to previously had a back room where they were doing a lot of dry cutting. And as you can see on our chart, for our fabricator 1 that we sampled, he had an exposure of 2,000 micrograms per meter cubed, which is over 40 times the OSHA permissible exposure limit. The other fabricator was also very highly exposed, as he was at 1,700 micrograms per meter cubed. In both of these instances, this meant that both employees had to be wearing full mask respirators, so with the face covering, and they couldn't wear N95s or half masks with just the cartridges on the side. And this is due to them needing a higher protection factor due to their exposure. So after we sampled, we gave the results to the employer and told them everything they needed to do in accordance with the standard. and they requested another follow-up visit to see if any changes in engineering controls would create lower exposures. So they created a whole new pummeling system in the back where they were able to introduce water-fed tools. So in doing so, we came back a few months later and we resampled the two employees in the dry cutting room, and we saw a very large reduction in the employee personal exposure. So for our first fabricator, he went from an initial exposure of 2,000 to only 46 micrograms per meter cubed. However, this is still over the permissible exposure limit, so the employee is still required to wear respiratory protection. However, in this instance, now he does not have to wear a full face respirator, but a half mask respirator or an N95, which offers a protection factor of at least 10 times the OSHA PEL. In the case of our second fabricator, we also saw a reduction. However, we didn't see as high of a reduction of 230 micrograms per meter cubed. Again, this shows we are able to reduce the level of protection we need from our respirator, but new controls and other controls are still needed to reduce employee exposure to below the OSHA applicable limits. Respirators are always our last resort, and if we can engineer out that exposure in the first place, we want to do it as well. So with our studies, we've come away with a few takeaways and conclusions, as well as limitations of our program. One of the main things is that a lot of these small businesses in Georgia, at least, are not protecting their employees to adequate levels and are not in OSHA compliance as well. As we mentioned earlier, at least one person in every facility was above the OSHA action level. Some things that we have found, though, in our studies and other studies as well, is that utilizing controls such as wet controls can reduce employee exposure to crystalline silica and can drastically reduce it when those wet controls haven't been implemented. However, it's also important to note that just including wet controls by themselves aren't always enough to reduce employee exposures to a safe level or to levels that OSHA mandates. So we want to look at other ways that we can do this, whether it be adding ventilation or having other work controls or making some kind of schedule where we're not always using engineered stone. And another thing we want to look at is that manufacturing schedule. So if you're working on engineered stone all day, every day, that can have higher results besides using something like granite where you can have lower silica exposures. One other limitation we had with our studies is that as an OSHA consultation program, we're limited to being on site for 1 day, maybe 2 days tops if we do a follow-up. Therefore, if the day that we're out there isn't fully representative of what actually happens at the facility, we can mischaracterize exposure levels. So we are just working with what we have on that day and going by what the employer is saying usually happens. But that is a limitation that we hope to overcome one day if we are able to do more follow-up visits and really get a grasp on what that facility is doing. In conclusion, I want to thank everyone for joining in on this presentation and reviewing our poster. We want to drive home the point that we're not trying to scare anyone, but we want to highlight some of the risks that come with stone countertop fabrication and some of the ways that we can curtail this exposure because silicosis is something that is preventable. I want to thank the OSHA consultation program in general for allowing us to do this kind of work, and the Wisconsin Occupational Health Lab for aiding us in assistance of analyzing our results. Thank you everyone for tuning in today, and I hope you have a great day and enjoy AIHCE. Thanks.